Hello.
Hello, doctor. Hi.
Hi.
Thank you so much for joining. I guess it's a really intense time right now in Geneva.
It is, yes.
Perfect. So we'll keep it really short and we jump straight into the question. We have already a lot of members connected, and on social media, soon other people will be following us. So thank you so much for joining. I'm Andrea, the person that emailed you. And just to give you a really brief overview to you and to all attendees of the event, basically, today we're going to discuss about the future of pandemics. So what is going on right now and what we think will happen in the future in this kind of crisis. To give you a quick presentation of our point of view, obviously, we are a global movement of a citizen movement present in more than 80 countries. So obviously we have kind of a positive stance toward global organization that are fighting global challenges. So we are really, really happy to be speaking with you. And obviously, as also citizens, we are concerned about what's happening. We have loved ones that might have suffered from the virus and the pandemics. So we really, really look forward to this discussion to hear from an expert, the chief scientist, basically, of the fight against the virus. Colombe and I are the co-founders of Now. Colombe will basically host the question part, and we'll ask you a few questions. And then if we have a few minutes at the end, we'll collect some questions from the chat from our members here with us. So once more, thank you so much for joining. And now we'll pass the mic to Colombe.
Hi, I'm Colombe. So to reiterate for everyone, unfortunately, we know you have to leave in approximately 20 minutes. So we get down the hundreds of questions we have for you to 3, and to make sure we can do this in 10, 15 minutes and then take a few questions from the audience if possible.
Okay.
So thank you again. My first question for you concerns what we can expect from COVID-19 in the next few months. So how long will it impact our lives and how will we ensure, if we ever get to this point, a fair distribution of vaccines across the world to all countries?
Not such an easy question. So hello, everyone. Nice to connect with you all. I'm Swaminathan, and I'm the chief scientist here. And of course, this is an incredible time to be in this position in WHO. I used to be a researcher in India working on TB and HIV. I'm a pediatrician by training, and I've been here at the WHO about 2.5 years now. And we created the science division last year. The DG decided that being a normative organization, the one that sets guidelines and standards and policies, and it was important to have a science division that really sort of was at the center of everything that WHO does. And I've been working on building the science division, on our norms and standards work when this pandemic happened. So obviously now we work hand in hand with our emergencies program on all the evidence synthesis, putting out the technical guidance, making sure we have all the right data, linking up with countries, promoting research on the right topics, on the right subjects, and also running some of the big research projects. Some of you may have heard of the Solidarity trial. It's a trial of 4 different treatment options for COVID-19. These are all what we call repurposed drugs. They're drugs already used for other diseases, like for HIV or for malaria. But what we need is a study that can really compare all the different treatments, which people just propose, or there's a hypothesis, but you need to study them in a properly designed controlled trial and have enough people in every group to be able to see conclusively. And that's one of the things we've seen in this pandemic is because people are desperate, because people are fearful and people are dying, healthcare workers also are desperate for anything that can help patients. And so a lot of products are being used without enough evidence of safety and efficacy. So the WHO strongly believes that what the world needs now is properly conducted studies, properly designed studies. And so the Solidarity trial actually has over 100 countries that want to participate. At the moment, we have about 15 countries that have joined and about 2,000 patients that have been what we call randomized, which means you get allotted to one of the treatment arms. And hopefully in 2 months, we should have a good idea of which of the existing drugs work, and then we'll be able to add new drugs to that trial. Now, the question about vaccine is important because we know now that the virus is firmly established in most countries around the world. Of course, what you see is the epidemic is at different stages in different countries. And so it might look that Africa is not having such a bad outbreak, or that South Asia is not having such a bad outbreak as Europe or North America. But it's quite possible that in the weeks and months to come, that there's just been a delay, and that now we will start seeing this in those parts of the world that haven't seen it, Latin America, Africa, and South Asia. So a vaccine is the only long-term solution for this. Of course, there are many scientific challenges. Let me tell you the good news. Good news is that there are over 100 vaccine candidates currently in development across the world, practically in every part of the world, not just in big companies, but also in smaller companies, in biotechs, in companies in India, Vietnam, Indonesia, China, Russia, and then of course, the big pharma companies in the north. Our goal, we start from the other end, not from the research and development, but our goal is access. WHO's goal is equitable access. So people who need the vaccine should get it, regardless of paying capacity or which country they live in. And think about COVID, it's interesting. It's even within countries, you could think about people who are more vulnerable than others. We know, for example, healthcare workers are the most exposed. Other frontline workers, critical workers, they are the ones we see getting infected. So if there are limited stocks of vaccine for the world, at least initially, let's say we get a vaccine in 9 or 12 months, and there are only a few millions of doses, who should receive them? Certainly it should not be those who can pay. That should be not the way we want the world to decide. But there should be some consensus that healthcare workers, nurses and doctors get it, or some such formula, some equitable distribution. So right now we're at an early stage. 7 vaccines have gone into human studies, but more and more will start. They need to go through different phases. So generally when a new drug or vaccine is introduced for the first time into humans, you go through a phase 1 study, which is safety. Then you go to a phase 2, which is larger. Then a phase 3, which is the big study, which establishes whether a vaccine is effective or not. In this case, we will need to compress. We can't take 5 years and 10 years to develop this vaccine. That's the normal timeline. We compress it. The regulatory agencies are working with us. Even then, even if you're super fast, it's going to be like 9 months, 6 to 9 months to 12 months. And then you need to manufacture those doses. So we put out last Friday, many of you would have seen in the press, a big call for something called the ACT Accelerator. ACT stands for Access to COVID Tools, Diagnostics, Therapeutics, and Vaccines Accelerator, focusing on access, but calling upon the world to collaborate, to fund this, because you rather fund tens of billions into this rather than trillions of dollars of economic damage around the world. And so we hope that the world will actually come together and move strongly in this direction. Over.
Thank you very much for the explanation. And just concerning the second part, you mentioned that WHO obviously wants a fair distribution of vaccines, which I'm assuming no one can disagree with. For all of us who are not extremely familiar with the work of WHO, will it have a specific role in ensuring that countries that are, might not have the same financial capacities to buy vaccines and so on will have equal and fair access to vaccines? Or is it outside of the WHO scope?
No, it's very much in WHO scope. I mean, that is our primary goal, is health for all everywhere. But it does need the cooperation and consensus building of all countries, what we call our member states. So we can make guidelines, but we can't enforce them. And therefore, this has to be a consensus building approach. And I think we're seeing in general, during this pandemic, we've seen much more openness on the parts, not only of countries, but on the part of even the big companies. They're actually saying, no, we have to do this not for profit, but to get people back, get the world back on track. So we're hopeful that there's a general feeling now that this needs to get done without the traditional ways of, for-profit research or patent protection and things like that. So let's hope there's a different paradigm.
Amazing. I think Andrea wants to take a question from the audience at this stage, if you want to go for it.
Yeah, I think there are already like really good questions pouring in, but I think that basically the most pressing one that now I don't find anymore is, do you believe that basically the WHO should have a stronger role in the future to deal with these pandemics? Because exactly the fact that right now it cannot enforce certain guidelines, it cannot ensure certain things, but just work with member states to make it happen. Do you believe that more competencies and power should be given to the WHO in these exceptional circumstances?
Well, one thing to understand about the WHO is made up of the member states. We have 194 member states, just like the United Nations is made up of its member states. They set the rules. We follow them. So WHO is like a secretariat that serves the member states. And so what we follow now are what we call the international health regulations that were agreed by member states in 2005, and which laid down a number of actions that they should do and a number of actions that WHO should do. So I think now this is a very good question. It's a good time to really think about, does the world need an agency that also has some clout, some authority, functions like inspections, which some of the other agencies have, right? Like the Atomic Energy Agency, for example. So if that's what the majority of countries want, then they can always modify the rules or give additional powers to the WHO to do that. So this is something which needs to be discussed. And of course, we would be open to that. The other thing I just want to say is that, a lot of criticism about WHO's role in the early days and things like that. And what we've been saying is, yes, we're completely open to an audit. And there should be an audit. There should be review of our actions, of the actions that countries did, and also the actions that WHO took. And if we've made mistakes, we have to learn from that, so we don't repeat it next time. It's true for countries as well. Lots of countries didn't take it seriously when WHO was saying that this is going to be serious.
So thank you for this. It actually leads to my third and last question on our side before we take all of the questions from the audience, which is, again, it's a highlighting that we stand for multilateralism and believing that the WHO is one of the much needed organizations right now in fighting global issues. We have seen a lot of controversies. So from countries that haven't reacted fast enough and have not listened to the advice of the WHO and of other countries already impacted. But also there's been a lot of political attacks against the WHO. From President Trump withdrawing support to influence allegations, the bearing of Taiwan in meetings, the fact that the WHO allegedly didn't fact-check human-to-human transmissions. You mentioned that the WHO would be open to an audit, but do you already see some lessons learned, both in terms of mistakes and best practices, that we should take away post-COVID-19 to be able to better the organization and hence the response of the world next time this happens?
Well, the first lesson is that the world does not invest in prevention. So the WHO has been saying for a long time, and many others. There's this video by Bill Gates, a TED Talk, I think he did in 2015, that talks about the pandemic that's going to come and urges everyone to prepare. Scientists have known for a long time that there will be a virus, that it will jump from animals to humans, that it will most likely be a respiratory virus, and that it can cause a pandemic. It was just a question of when. Everyone thought it might be an influenza virus. It turned out to be a coronavirus. But the question is that countries have not invested in their health systems, in surveillance, in preparedness, in training their frontline healthcare workers, and in having enough, personal protective equipment, in the data collection, in all of these things that we need now. And so I think that is the lesson, the first lesson to learn. There may be other lessons, I think, around also now we're realizing you need global solidarity and collaboration, that no one country can get rid of this because it's everywhere. And so nationalism and thinking about doing things within your own borders is not going to be a solution in the long term, because you cannot stay in a state of isolation or a lockdown forever. So to me, those are the two big things.
And we couldn't agree more, especially with the second one. I mean, this is our whole motto. So what goes beyond borders should be treated as such. I know you just have a couple of minutes left, so we really just want to try to ask a few questions we received from the audience, and please do tell us whenever you have to go. We understand you're very busy today.
Yeah, I'll get one from the chat, because I think there's something that, as not expert, we hear a lot and we read a lot in newspapers, is about antibody testing. So there's Emilio, there is a family member of a COVID-19 survivor, and I'd like to ask about what research is being done through the WHO on antibody testing, and what a timeline for that could look like.
So we have a whole network that works on different research areas. So we have one network that's actually working on antibody testing, or what's called serological testing, or seroepidemiological studies. And the idea really is, and many countries have already started coming with the results of the studies that showing certain percentage of the population are infected. So it's not useful for individual patient diagnosis. So WHO does not recommend the antibody tests if you are ill and if you need a diagnosis, but more in terms of knowing what's going on at the population level. So for example, I saw results from Switzerland that showed that about 5% of Geneva's population was infected, was positive for antibodies, which means they've seen the infection at some point. In New York City, it's 20%. In a small town in Germany, it was 15%, and so on. So what that does is it helps the planners within the health ministries or departments know how bad the infection was in their own area. And also it tells you the majority of people are still susceptible. So if 5% of the population of a country has antibodies, it means 95% have not seen the virus as yet. And that means that further exposure and further continuation of this infections, which have been temporarily interrupted by all these physical distancing measures, could potentially restart when people start meeting again. So in a way, it's a very sobering number when you hear only 5 or 10% of people have developed antibodies, because you remember at the beginning, there were countries who were saying, let's just expose everyone, get herd immunity. And some people may die, but then the rest will have immunity. Well, millions of people need to die by the time you achieve that level of herd immunity of 70 or 80%. So that's not a solution for us. So that's why, again, coming back to a vaccine, the only way to get herd immunity is through a vaccine.
Thank you so much for this one. And I want to immediately jump into another question that I see from Martina. There is a really good point, because before you mentioned how it's difficult, like how countries do not like to get prepared for this eventuality. And so from one of our young members, the question is, do you think that after what happened this time, there will be a different kind of preparation, different kind of acknowledgement of the problem, or because of political choices, it will continue to be, an underfunded sector, and we're gonna hit the rock again if it happens?
Yes, unfortunately, I don't want to be cynical. I want to be hopeful. But what we've seen are cycles of panic and neglect. So you panic when there's a pandemic, an outbreak. There was panic during the Ebola time. And the donor countries released large amounts of money to deal with Ebola in West Africa, and then again in the DRC. But the same countries need continued investment for preparedness. And the investment for preparedness is actually much less than when you think about what you need to spend on once a pandemic has hit. So, but still it doesn't attract that kind of investment. I do hope that after this, it will change, that the world will realize how the whole world has been brought to its knees now by a virus, and that we can't afford for this to happen again.
And we will definitely also ourselves as a global movement try to, spread some things around this and make sure that people realize it. If you maybe have time for another question from
Maybe
Noor.
last one, yeah, sure.
Last one then. It's that I received from Noor from Tunisia. She's saying that in Tunisia, they don't have a lot of cases announced each day, around 5 to 4 per day. And the death rate isn't high at all. So she's asking whether there's natural resistance to the virus or whether some natural factors impact the virus in general.
And I see some more questions on vaccines. I could also address that. So for Tunisia and for many other countries, as I mentioned, in Africa and even in India, which is where I come from, people are saying, what's going on? Why so few cases? Do we have natural resistance? Is it genetics? Is it the weather? Is it this or that? Well, as of now, we don't know. But what we think could be the reason is that the country is just on a later stage of the progression. It might have arrived in the country later. It may be taking a little longer to spread. There may be less international travel. So one thing we have seen is the cities badly affected. New York, London, Milan are the ones with huge international travel. And originally, of course, the virus traveled out of China. So a lot of travel brought a lot of infection, probably more infection. Africa does have a lot of travel and things with China, but perhaps not as much as New York and London. So the same for India. The other is the demographics. The people who are getting really sick are those who are older. And demographics of Africa, South Asia, majority of people are younger. So it may still be circulating, but maybe people are not getting so sick. And so we cannot, at this point, claim that some populations or ethnic groups have any resistance to the virus. One last point is the measures that countries have taken. So countries that took the warnings seriously, when we declared on the 30th of January, what we call a public health emergency of international concern, which is our highest level of alert that WHO can put out. Some countries took it very seriously, started doing all the measures that they need to do, the screening of travelers, the isolation, the quarantining, the testing. You see how Germany and South Korea in particular tested huge numbers of people. And these are the two countries that have shown success in containing and also in keeping the death rates very low. Countries which took it casually and easy have seen this sudden exponential spike with a lot of deaths and the health systems being overwhelmed. So perhaps Tunisia, there could be a combination of these reasons why, but some of it is the virus, some of it is how we respond, how the public health response was. Very quickly on vaccines, the testing plan for the vaccines, there's a question about how do you test them rigorously. I mentioned the phases of testing. What WHO would like to see is, because I talked about reducing timelines, but without compromising patient safety. It doesn't mean that you push unsafe things out into the public. We have to be very careful about safety. So we need to design trials which can study both safety and efficacy well. And only then it will be advocated for wider use. And then there's a question on decentralized vaccine manufacturing facilities in order to guarantee supplies. Very important. Yes, that's one of the things that we want to start. We want countries to start investing in right away, even before we know which vaccine will ultimately be successful, which means a lot of investment has to be made now, and some of it will be not utilized. But unless you have that investment now, you can't have the millions of doses. So certainly the vaccine manufacturing in the developing countries needs to be ramped up. It needs collaboration with the big vaccine developers and manufacturers. But unless we have decentralized manufacturing, we won't be able to supply the world.
Thank you so much. It was really clear. And I don't want to hold you any farther because, I mean, you probably have to save the world and we already took like 8 minutes more than what you want. I don't know if you have any closing remarks before leaving, but we are really thankful for your time.
Well, somebody is saying, what will the world be like after the pandemic? I don't know, it's hard to predict, but I hope that at least some of the things that we used to do before that we will do differently. One of the observations was that after introducing all these distancing measures and things at countries, and the hand hygiene and all of those things, that the rates of influenza dropped significantly as well. So we can actually reduce the rates of other infections if we follow some of these hygiene and ensure the water sanitation everywhere. But the other thing is, I think, the environment, and at least one has seen data from some of the most polluted places in the world now showing significant drops in air pollution. And because of course, there's no travel and so on, there's a lot of changes in our day-to-day lifestyle. So not that we can stay like this forever, but I think we should think twice about, do we need to go to that next conference, or can we do it like this? I mean, after all, we are reaching each other quite effectively and saving a lot of fossil fuel. So I hope that will also make, and I think most of you are young people and believe in having a greener planet. So those kind of changes will be good. And also changes in the way in which we treat animals. It's the loss of their natural habitat, and of course the illegal trade in wildlife that causes a lot of these viral infections to jump from animals into humans. So it makes a lot of sense to respect and protect animals and their biodiversity and their natural habitat, as well as improve the environment for ourselves.
Thank you for this. I mean, your closing remarks are, apart from being resonating a lot with all of us, I think perfect, because we just received some questions on social media exactly about this.
Thank you very much. Nice to talk to you all. Okay, bye-bye.
Have a wonderful end of the day. Thank you so much for joining.
Thank you. Bye-bye.
For everyone else on the call, we know that it was shorter than intended. Again, we apologize, but she is being pulled into an emergency meeting, which honestly is the best reason to make an event ever. But we hope you like the event. We thought of doing a quick wrap up after that Andrea prepared as well. We know we couldn't answer all of the questions, but feel free to tweet at her and continue to interact on social media. We just wanted to add a few words now as well.
I mean, what can you say? Like, I think that it's really inspirational, and I love the fact that in this kind of environment, we could actually hear the science and understand better, at least for me, how this will play out. So the antibody, the answer on the antibody testing, the vaccine, the timeline. I think that the chief scientist really, really brought a lot of value in that, because of course, the news are often not so clear. And I also really like her closing remarks about how our social life will continue, because I was a bit scared that she would have gone with something like it's better not to touch anyone anymore and stuff like that. But actually she is really encouraging, in a sense, our social life will get back to normal, but choices will be made maybe by us to pollute less or to have less contacts that are necessary and actually harmful to the planet. So I found this talk really, really inspirational. I like the fact that she didn't shy away from the most political topics, like the attacks that we mentioned, the controversy with Taiwan. It seems to me that she's a woman of science, more than obviously the political side of the organization, but she understands the limit that the current structure of the WHO has and continue to have. So I really wish that someone like her continues to do her job. I don't know a huge lot of her, past endeavors in the organization, but I'm following her now since a few weeks in her new role as a chief scientist and executive director. I think she started only this year, and I think it's the right character that we need in these difficult times. I wish that she had more space actually in the media to address the worries and the concerns of the people.
Completely. And I personally can't wait to see an independent investigation into, as she mentioned, an inquiry into how the WHO handled the beginning of the crisis and the Sino influence, to have some answers as to all of this, which, as a global movement, we believe in intergovernmental organizations. We believe that we have to have super strong world organizations to be able to deal with global challenges. But we also know that for people to have faith in them, we need transparency and we need answers on issues like organizations relaying messages without fact-checking them. I'm sorry if you hear terrible noise. There's someone exercising above my head, so my roof is shaking a lot. I hope you can't hear it too much. just to close quickly, before we all let you go, Laura, the little bot on the right, just sent a poll that you can see asking if you believe that the WHO should have more independent authorities and power over nation states following this discussion. If you can try to answer to this quickly, we can have the results and see them together. Unfortunately, we can't vote as the panelists. But I think, you know, in the original talk, I apologize for the noise. In the original talk, we intended on asking a bit more as well about overall governance and the future of the WHO and the reform needed. And so we also want to hear from you to continue the discussion offline.
Yeah, so vote. Well, did the vote, is the vote still going, or are we, perfect. Okay, so it's overwhelming majority voted for more powers to the WHO, and like most people have voted. So it's a good takeaway from us. Clearly, it's not a
authority, not just power, independence. I'm sorry.
As well, yeah. It's not a plebiscite, and this also because obviously there are controversies probably around the WHO and things to fix. But I like the direction that this talk has taken. And as a global movement, we'll obviously push for sure more global governance, but also independent and fair governance, because the big problem is exactly what the doctor mentioned at the beginning. You know, like global institutions are actually member states coming together. They don't have a lot of authority, don't have a lot of independence, and especially WHO, contrary to other institutions like the UN Security Council, do not have any binding power on member states. And actually, it has also a really small budget. So there are many things to fix. And now that we are all facing a pandemic for probably the first time in our lives, we understand how important is the role of global coordination in tackling global challenges like pandemics, but also I would at least mention the climate crisis and other big challenges that our generation and our time are seeing. So thank you so much for joining once more. Thank you, Colombe, for the questions and the precision in your demands to have light and clarity on the political controversy of the WHO. Thank you to Laura for being behind the logo and moderating everything. Thank you to Bettina, the streaming with her phone the talk on Facebook because the connection didn't work well. And thank you to all of those that joined.
And to everyone, please make sure, considering the fact that we ended with the climate crisis, that you sign a petition demanding the UN to declare global climate emergency and finally take concrete action. Laura will be sharing the links in the chat and we'll send it in the follow-up email as well.
Thank you so much.
Okay.